I think the rollout has been handled very poorly. I think a lot of the due diligence was not done, and I think that's clear because it was done in such a rush. Joel, so a lot of companies and labor groups we have spoken with are really finding themselves in a pickle in terms of not understanding how they're going to deal with this. And this goes everywhere from not having a suitable drug marijuana roadside test to be able to ensure people aren't high when they're driving or working. Yeah. So a lot of companies are questioning how they deal with this, and they're treating it like any other substance, whether it's drugs or alcohol. And I was really surprised in meeting with some groups over the last couple of months that airline pilots, public transit drivers, heavy construction. It's not mandatory to be drug tested, and I think that's something that we have to look at on the federal government side, the federally regulated entities like airlines, like public transit, like rail, that we should look at mandatory marijuana testing for these sensitive safety positions.
And if it's not federally regulated, I understand sort of the position of not wanting to get too far into the private sector's business, but if it's not federally regulated, do you have any thoughts about how companies should sort of navigate these new? It's a brand new policy. It's a brand new sort of cultural shift. Do you have any thoughts on where the private sector should be going with this, or how they can communicate things properly, or initiatives that your party might introduce?
Well, it's not even, Joel, like a private versus public sector conundrum. It's the fact that the private sector drug testing and alcohol testing is a provincial jurisdiction. So we would have to, and I think that's something we should be doing is working with the provinces and territories to develop, a national umbrella policy on this. And it's my understanding, I have to do a little homework on that, but Alberta has something like that in place. I know in the energy sector, the private companies do have, a lot of them have mandatory drug testing, not all of them, but you would hope that at the federal level we set the example, and we're showing that this is something that we take seriously, and the private sector would follow along.
I would say that on the cannabis issue, it has been dealt with properly. I think, as I said, I think we still have enough unrecognized threats in other addictive substances, and particularly alcohol, but I don't think the addition of legal cannabis, certainly I'm not hearing about it from employers in my area.
Okay.
I do think we'll have to see how it goes. It's relatively new. There's certainly some forms of employment where you want zero tolerance on cannabis if you're an airplane pilot.
Right.
The reality is, for most workers, if they indulge in recreational cannabis on a weekend, they probably did that before it was legal.
Well, I think, from our perspective, substance use in the workplace is not a new phenomenon. We've had cannabis for ever. We've had alcohol. We have a variety of different prescription and non-prescribed drugs, a variety of legal and illicit drugs that have been with us for a very long time. And I think, again, workplaces know that they need to have a workplace substance use policy. We certainly have been supporting federally regulated employers and really anyone in terms of making sure that their policies are up to date, and working with our partners like Betco to ensure that conversation continues. But I will say that at the end of the day, federally regulated employers don't tolerate impairment on the job. That hasn't changed since the legalization of cannabis. Employees have a duty to work safely. Most employers, if not all, have rules around impairment at work, and if they don't, they should be reviewing their substance use policy to make sure that it's current and that they have a very strong protocol around substance use at work. We continue to work with our partners, provincial, territorial, and our federally regulated employer partners to really understand how cannabis is affecting workplace health and safety. But from our perspective, this is an ongoing conversation that did not change on October 17th. It is really It's a new phenomenon in terms of legalization, but it's not a new drug, and it is certainly falls within the realm of substance use policies that address substance use in general at the workplace.
Okay, and the last question has to do with prescription drugs. It's obviously a huge cost for employers. I know you can't really speak to the healthcare policy issues, but if you have any thoughts on how to help employers with rising costs and rising usage, I guess of prescriptions, biologics, things like that.
Well, absolutely, we agree that drug costs are unaffordable, not just for employers, but certainly from the Canadian individual perspective. When Canadians, or especially Canadians that are living in poverty or with low income, are having to make the decision about whether or not they buy groceries or buy pharmaceuticals or prescription drug, that's untenable, and we know that we need to do better as a country, and that's why. We've taken some steps already to try and reduce the cost of drugs in general, and one of them is joining the Pan-Canadian Pharmaceutical Alliance, which is going to help Canada save $2 billion annually, proposing major reforms to the patented medicines regulations, which will obviously help protect Canadians from high prices. But I think the other thing, and you saw this in Budget 2018, is we have a council right now that's studying national pharmacare and what a model might look like that would be affordable for Canada. Certainly, we look forward to the council's final report. It's going to guide us on how we move forward with a national pharmacare program that makes prescriptions affordable for all Canadians. Because as you point out, it's expensive for employers, but it's expensive for Canadians, and there's not equal access across the country. So I look forward with my colleagues to the report of the council, and that should be forthcoming.
More focused on providing information, health benefits, or health risks, I should say. We should always talk about health awareness, health promotion, and so there hasn't been enough emphasis put on making sure people are making an informed decision about their use of intoxicants generally, but specifically with cannabis. The impact on young people, the impact on development, on mental faculties. These are things that I would have provided more information. The provinces and municipalities who are kind of struggling with how to make the best decisions around access, those things I would make sure that we've provided good, solid research and evidence around what are the best ways for ensuring that we've got the healthiest and strongest population, and provide that information around what is the best way to provide access or to roll that out.